Let's be honest, no one wakes up at 70 or 80 thinking, I can't wait to spend the morning coughing and clearing my throat. Yet day after day, many older adults find themselves stuck in that exact routine. The truth is, it's not simply dryness, old age, or plain bad luck. In most cases, there are very real, often preventable reasons behind it. The encouraging news? Once you understand what's driving the problem, there are simple, natural steps that can make life more comfortable. By the end, you'll know 6 practical things you can try tonight. No costly treatments, no confusing medical language. But first, we need to clear up one common belief that leaves too many people suffering longer than they should. When just aging isn't the answer. For many older adults, the explanation they've been handed is simple. Excess mucus is just part of getting older. It's talked about like graying hair or stiff joints, something you're meant to accept without complaint. That assumption leads to resignation. Days begin with a clogged throat, a chest that feels heavy with phlegm, and a morning ritual of coughing and throat clearing. Too often, the discomfort is dismissed with a shrug and the thought, that's just how it is after 60. But here's the problem with that mindset. When mucus is brushed aside as unavoidable, people miss the real reasons behind it, and also the chance for relief. The risk of writing it off as inevitable is clear. Once someone believes the issue can't be changed, they stop asking the questions that matter. They may never notice how hydration levels, medications, or room conditions are at play. And they miss that mucus isn't just a nuisance, but sometimes the body's way of signaling irritation or imbalance. Health reviews in 2025 show that in most seniors, the explanation isn't aging alone. It's usually tied to preventable or treatable factors like environmental triggers, acid reflux, medication side effects, or dehydration. If these are overlooked, the cycle continues without resolution. Surveys and clinical reviews show many older adults assume mucus is just part of aging, which means treatable causes often go uninvestigated. This tendency fuels unnecessary suffering. Millions live with year-round congestion that could often be improved by changes as simple as better hydration or adjusting nighttime habits. To put the health stakes in perspective, CDC data also show that adults over 65 account for most severe outcomes from seasonal respiratory infections. While mucus doesn't always indicate illness, persistent symptoms in later life deserve attention instead of dismissal. One story captures how powerful even a small shift can be. In his late 70s, a man spent years living with constant throat clearing that worsened in the winter and never fully disappeared in summer. He never raised the issue with his doctor and joked that it was just part of growing old. Then his daughter brought home a small digital humidity monitor. It revealed his indoor air dropped to extremely dry levels each night, especially in the bedroom. A modest humidifier made more difference in a week than any cough drop or lozenge had in 10 years. His aging problem turned out to be an environmental one, and it was fixable. Stories like his prove just how often the belief itself creates the barrier. Once someone sees mucus as more than an inevitable byproduct of age, they start noticing actual patterns. Is it worse in winter? Is it heavier at night or after certain foods? Does it worsen after taking particular medications? Observing those details starts to reveal the real drivers. For viewers, a helpful step right now is to note, do your own symptoms show up daily, seasonally, or after meals? That simple awareness makes the solutions ahead easier to apply. Why does the just age idea remain so ingrained? One reason is the slow pace of change. Mucus seems harmless at first, maybe a little throat clearing in the morning. Over the years, it becomes an established routine. Carrying tissues everywhere, clearing your throat before speaking, typing it up to bad air, rather than health. These changes creep in quietly until the condition feels automatic. Because mucus builds gradually, It doesn't feel like a sudden warning that would push someone to investigate. Instead, it blends into the background of normal life and, without education, gets written off as permanent. There's also hesitation to bring it up. Mucus simply isn't a subject many want to discuss. Seniors may downplay it in appointments to avoid embarrassment or avoid mentioning it to friends to keep the focus off their health. But silence allows the idea of inevitability to persist unchecked. Many quietly tolerate discomfort, assuming everyone else is doing the same. What updated data makes clear, though, is that intervention helps most cases. That means bringing it up isn't pointless. It's often the very thing that unlocks relief. Another concern is that not all mucus is minor. While dry winter air or spicy late-night meals explain many cases, long-term daily mucus can sometimes connect to more serious conditions like chronic lung disease, heart failure, or untreated reflux. Ignoring excess mucus under the belief that it's just aging risks allowing the body's warning signs to go unheard. Even when the cause is relatively simple, relief from daily irritation can still add up to better communication, improved sleep, and a lighter start to the day. This is why change begins with mindset. Once older adults question whether mucus is truly unavoidable, they open the door to options. Relief may come from adjusting environmental triggers, increasing fluid intake, or reviewing medications with a doctor. The first real shift is understanding that improvement is possible. From there, even small adjustments break through the sense of helplessness that keeps symptoms locked in place. It's worth being realistic. Yes, aging does bring physical changes. Sinus tissues dry more quickly. The tiny cilia in nasal passages move more slowly, and reflexes that once cleared mucus efficiently aren't as sharp. Those shifts set the stage for more congestion. But research makes clear that these changes do not eliminate the possibility of comfort. The gap between producing a manageable amount of mucus and struggling each morning with heavy phlegm usually depends on modifiable factors. Believing it is just age prevents practical solutions from ever being tried. The encouraging takeaway is this: seniors are not powerless against mucus, even if they've lived with it for years. By moving beyond the blanket excuse of aging, each person can investigate their unique contributors, whether it's air quality, hydration, diet, or medication. Relief often comes from identifying those triggers and addressing them directly. Seeing mucus as destiny delays recovery, while questioning it opens the way for tangible progress. And that leads to an important question many people quietly wrestle with: why does mucus so often feel worst right after waking up? The silent drip from aging sinuses. One of the most common hidden contributors is what happens inside the sinuses as we age. Subtle changes in the nose and sinus tissues create what's often called post-nasal drip, a slow, steady trickle of mucus down the back of the throat that becomes particularly noticeable after resting. As the body grows older, the lining of the nasal passages loses some of its ability to stay moist. Surfaces that once felt smooth begin to dry out, and this makes mucus thicker and harder to clear. At the same time, the tiny hair-like cilia that move debris and fluid forward begin to slow. Instead of sweeping secretions out through the nose, they let mucus linger and collect. When someone lies flat during sleep, gravity encourages that collection to flow backward, which is why the effects are often most obvious in the hours after waking. The result is a set of familiar symptoms: throat irritation, the constant urge to clear, and a dry cough that may last well past breakfast. Even if the person feels fine otherwise, these sinus changes are enough to spark a cycle of discomfort. Some only notice a mild tickle, while others deal with heavy phlegm that dominates the first part of every day. The impact isn't just physical. For many, this morning ritual feels embarrassing. One older adult described trying to greet his grandchildren over the phone each morning only to spend the first minutes coughing and apologizing. Situations like this can make people pull back from conversations or avoid early appointments. Over time, the annoyance chips away at confidence and reinforces the idea that mucus simply has to be tolerated. But this condition isn't beyond help. Simple environmental and lifestyle shifts often lighten the burden. Restoring bedroom humidity prevents the nasal lining from drying too much overnight. Many homes drop to 20% humidity in cold months, while the nose does best around 40 to 50%. A small humidifier set to that range can dramatically reduce morning congestion. Sleep position is another factor. Lying completely flat allows secretions to slide straight toward the throat, elevating the upper body by just 4 to 6 inches, whether with a wedge pillow or by raising the head of the bed frame, alters the drip path and reduces the intensity of morning symptoms. Daily rinsing also makes a difference. A gentle saline wash before bed thins secretions and clears irritants, leaving less material to accumulate overnight. This simple step, supported by clinical research, is safe, inexpensive, and often surprisingly effective. So for anyone frustrated by that silent overnight drip, here are 3 things to try tonight. Run a bedroom humidifier and aim for 40 to 50% humidity. Use a saline nasal rinse before bedtime, and raise the head of the bed by 4 to 6 inches. These low-risk steps can soften mucus, protect sinus tissues, and shift how much ends up in the throat. When people try even 1 or 2 of these approaches, the difference is often immediate. Instead of starting the day with a hoarse voice and repeated throat clearing, mornings can begin more comfortably with fewer interruptions to talking, eating, or enjoying company. Relief, even partial, proves the point that age-related sinus changes are manageable and not simply inevitable. Of course, not every case comes down to sinus tissue alone. Other factors can intensify mucus production or drying, especially those linked to common health treatments. And that raises another overlooked question. Could the very medications designed to protect health also be worsening the problem? Medication side effects you never suspected. Some of the very prescriptions that safeguard health in later life can also create unintended ripple effects on the nose, throat, and airways. Clinical reviews on geriatric rhinitis point to several common culprits: ACE inhibitors, beta blockers, alpha blockers, centrally acting antihypertensives, diuretics, and certain psychotropic drugs. These are widely prescribed because they protect against heart issues, blood pressure spikes, fluid retention, or mood disorders. But alongside their benefits, they are known to trigger symptoms like nasal dryness, cough, or congestion-like irritation. For someone already experiencing slower sinus clearance with age, these effects can intensify mucus problems more than expected. Diuretic medications illustrate this clearly. By working to release excess fluid from the body, they protect the heart and reduce swelling. Yet this constant fluid loss, even at a low level, gradually dries out tissues of the mouth and nasal passages. In compensation, the body often produces thicker mucus that clings to the throat and makes clearing difficult. Many older adults don't connect this daily irritation to their prescribed medication, when in fact the link is well documented. Blood pressure drugs, especially ACE inhibitors, tell another part of the story. They lower blood pressure effectively, a life-saving role for many. But the catch is that one of their documented side effects is a consistent, sometimes nagging cough. For some, it feels like a need to clear the throat all day, and the sensation can persist through different seasons or dietary changes. Switching pillows or adjusting humidity doesn't resolve it because the trigger lies in how the medication interacts with the airway lining. Antidepressants and other psychotropic medications also appear on geriatric lists of drugs associated with nasal and oral dryness. Because many of these agents reduce saliva production, they change the texture of mucus. Saliva helps thin secretions and keep them from becoming sticky. So when it decreases, phlegm feels heavier and harder to swallow. Combine this with a normal age-related reduction in thirst, which already lowers water intake, and the result is often a persistent clogging sensation in the throat. The challenge is not just these individual effects, but how they compound when multiple prescriptions are taken together. A diuretic's dryness paired with an antidepressant's saliva reduction creates an environment where mucus becomes thick, sticky, and unrelenting. Seniors may try all the classic lifestyle remedies: extra water, cutting back on dairy, using humidifiers, yet still notice morning congestion or all-day throat clearing. When everything else has been ruled out, side effects in the medication list may be the missing piece. It's important to be clear, these medications are essential. No one should ever stop or reduce a prescription without medical guidance. Hypertension drugs, diuretics, and antidepressants manage risks to the heart, brain, and overall well-being. The real solution is not to abandon them, but to recognize that if day-to-day comfort is suffering, medication side effects should be part of the conversation. Important, never stop or change a prescription on your own. Instead, bring symptoms to your prescriber and ask whether an alternative or dosing change might help. A good example is seen in routine practice. Clinicians often swap one blood pressure drug for another to reduce nasal dryness or cough. It's a common, simple adjustment when medically appropriate. In many cases, patients notice improvement within weeks. That change can mean the difference between living with a constant cough and starting the morning able to speak or sing without interruption. When raising the topic with a doctor, the key is detail. Mention when mucus feels worst, whether it's in the mornings after certain doses or during cold weather. Note any patterns of dry mouth, including nighttime dryness or trouble swallowing food. And always share a complete list of prescriptions. Geriatric reviews emphasize that medication review is a central tool for evaluating chronic rhinitis or cough in older adults. Without those specifics from the patient, patterns often remain invisible. The relief possible through careful medication adjustment is often overlooked. For many, realizing symptoms don't have to be permanently endured changes their outlook. What was thought to be aging or unsolvable congestion may actually be the body responding to an avoidable irritation. In this way, side effects offer not just frustration, but also an opportunity, a reminder to reevaluate, to ask questions, and to bring lived experience to the healthcare visit. This also raises a broader point about comfort. Seniors shouldn't have to choose between medical safety and daily quality of life. There is almost always room to balance both. When open communication with healthcare providers becomes the norm, mucus symptoms stop being written off as trivial and start being treated as real issues that impact sleep, speech, and confidence. For families and caregivers, this conversation matters too. Observing when a loved one clears their throat most often or avoids talking because of cough provides useful context to a doctor. Sometimes what patients describe as just an annoyance is seen more clearly by the people around them. Sharing those observations may help reveal medication as part of the cause. The guiding lesson here is that daily congestion doesn't always signal illness or lifestyle failure. Sometimes it's hidden in the pharmacy bag itself. And by reframing mucus as something that deserves medical attention, not just an inevitable nuisance, new pathways toward relief become possible. Even with the role of medications better understood, they're not the only factor making life with mucus more difficult. Another influence quietly shapes how airways feel, and it often explains why symptoms spike during certain seasons or in particular rooms of the home. When the air in your home becomes the enemy, cold weather months are often when mucus feels most relentless, but the reason isn't always infection or allergies. Much of the problem comes from the air seniors breathe inside their own homes. Heating systems, while essential for comfort, sharply reduce indoor humidity. Cold outdoor air already contains little moisture, and once it's warmed by furnaces or forced air systems, that dryness intensifies. The air becomes scratchy and irritating, and each breath pulls it deep into the nose and throat. The body reacts in the only way it knows how, by generating thicker secretions as protection. This same effect plays out in summer through air conditioning units. AC cools warm air, but also removes water from it. Seniors may find themselves congested in January and again in July, even when they feel healthy otherwise. It's not a coincidence. The pattern follows how artificial indoor climates strip the air of its natural balance. Older airways, already more sensitive because of thinning tissues and slower cilia, respond quickly to that lack of moisture. Instead of seeing this as just seasonal colds, it helps to consider the physiology in simple terms. Dry indoor air causes the lining of the nose and throat to become irritated. Irritation triggers more mucus production, which thickens without enough moisture to stay thin. That's why mornings feel clogged and tissues fill so fast. The cycle repeats nightly and doesn't improve until the environment changes. One retired teacher learned this firsthand. After nearly a decade of unexplained cough and heavy mornings, she tried different treatments without success. On a suggestion, she placed a small humidifier in her bedroom. Within days, her cough eased dramatically. It wasn't complex prescriptions or restrictive diets that made the difference. It was restoring moisture to the air she breathed all night. Practical steps can bring the same relief to many households, starting with humidifiers. Research supports keeping indoor air at 40 to 50% relative humidity for comfortable breathing and healthy nasal passages. By maintaining this level, mucus stays thinner, less sticky, and easier to clear. The machines come in all sizes, from small tabletop models to whole home systems. But one important precaution must be remembered. Humidifiers need regular cleaning. Without weekly maintenance, water tanks can harbor bacteria or mold, worsening symptoms instead of relieving them. Ventilation is another straightforward fix. Stale, recycled air full of irritants only compounds dryness. Opening a window for 10 minutes adds a dose of fresh air and restores balance indoors. Even cold air helps when exchanged briefly, especially during long stretches when homes are sealed tightly shut. Quick ventilation sessions refresh airflow, dilute dry air, and reduce the feeling of never escaping congestion. Hydration inside the body is as important as humidity outside it. Many older adults drink less water than they should, partly due to reduced thirst signals. But dehydration thickens mucus and makes it harder to clear. Sipping water regularly through the day, and especially in the evening, keeps airway linings moist so the body doesn't need to overproduce secretions. Combined with balanced humidity levels in the bedroom, this step can transform both the quality of sleep and the way the morning begins. These simple measures don't require much money or equipment. A basic humidifier costs less than many routine copays, and plants that add small amounts of moisture to the air are available at most stores. Ventilation costs nothing. What keeps people from trying these fixes is rarely expense. It's a lack of awareness that air can be the hidden factor driving their mucus complaints. The benefits extend beyond mornings. Those who once avoided phone calls or social time because of disruptive coughing often feel more confident again. Nights improve when deep, uninterrupted sleep replaces repeated awakenings for water or coughing fits. Even small gains accumulate, shifting mucus from an unsolvable problem to a manageable one. Still, it's important to keep expectations realistic. Dry indoor air is a major driver of senior congestion, but it's not the only one. Some mucus problems persist because of reflux, medication side effects, or allergies. But tackling the indoor climate is a powerful first step because nearly every home with heating or cooling systems experiences some level of imbalance. By correcting the environment first, seniors set a foundation for other relief strategies to work more effectively. Another common oversight is assuming dryness only matters when it's obvious, like chapped lips or itchy skin. In reality, the nasal tissues can be struggling long before those outer signals appear. Inside, the airway lining cracks, dries, and triggers persistent mucus as its quiet alarm. Recognizing these hidden signs helps prevent months or years of unnecessary discomfort. So when mucus seems to peak every winter, or even through sweltering summer days with constant air conditioning, it may not be illness or unlucky aging at all. It may simply be the invisible dryness inside the home environment. Humidifiers set to 40 to 50% relative humidity, fresh ventilation, steady hydration, and proper device maintenance are low-cost, realistic supports that often make a measurable difference. Once seniors see how quickly indoor air compounds the problem, it becomes easier to see congestion not as a permanent sentence, but as a response to specific conditions. Relief is possible when those conditions change. And while the air you breathe is one powerful influence, there's another factor many overlook. What sits on the dinner plate each night may also help determine how much mucus greets you by morning. Dinner choices that backfire overnight. What many people don't realize is that evening meals can have a much larger impact on morning congestion than expected. Certain dinner choices, especially when eaten late at night, often set the stage for thicker mucus, a hoarser voice, and the constant need to clear the throat upon waking. One of the most common explanations in older adults isn't an allergy or sinus infection at all. It's something called silent reflux. Silent reflux, formerly known as laryngopharyngeal reflux, operates differently from the familiar burning pain of acid reflux. The mechanism is simple. As we age, the muscle at the bottom of the esophagus, known as the lower esophageal sphincter, becomes weaker and does not seal as tightly after meals. When lying flat during sleep, small amounts of stomach contents can move upward. Even without noticeable heartburn, this acidic material reaches the sensitive tissue of the throat and voice box. Because those tissues are not built to withstand acid, they react by producing excess protective mucus. By morning, that extra mucus pools in the throat, creating the sensation of post-nasal drip, heavy congestion, and voice strain. This connection is often overlooked because the symptoms don't resemble classic indigestion. A senior may never feel burning in the chest or sour taste in the mouth. Instead, the only signs are a raspy voice, a dry cough, or the feeling of a lump in the throat that clears after hours of effort. Without awareness of silent reflux, many cut dairy, install humidifiers, or review their medications without improvement, never realizing their evening meal habits could be driving the problem. Consider how it affects quality of life. A hoarse voice in the morning can make phone calls awkward or singing at church frustrating. Constant throat clearing interrupts conversations and makes social gatherings uncomfortable. Coffee, which many people hope will restore alertness, can worsen the issue because caffeine relaxes the sphincter further, allowing even more backflow. The result is a daily cycle where each morning begins with discomfort and fatigue rather than a clean start. One example illustrates the process clearly. A retired grandfather dealt with heavy congestion every morning despite multiple adjustments to his environment. He tried humidifiers and medications, all without relief. During a checkup, a physician asked about his nightly routine. His habit was a large pizza late at night while watching television, usually followed by lying down soon after. With a few small changes, moving dinner earlier, avoiding eating within 2 hours of bedtime, and slightly raising the head of his bed, his symptoms began to lighten. Within weeks, Mornings that once started with near silence due to mucus finally allowed him to speak clearly again. This situation is far from unique. Heavy evening meals, fried foods, acidic sauces like tomato, chocolate, citrus fruits, alcohol, and caffeine all relax the esophageal valve or remain in the stomach longer, enhancing the likelihood of nighttime reflux. Combine these foods with lying flat, and even a very small amount of backflow is enough to irritate the throat. The reaction does not appear as sudden pain. It shows up disguised as excess morning mucus. The good news is that practical strategies can help manage the condition at home. The first and most reliable step is timing. Avoiding food for 2 to 3 hours before bedtime reduces pressure on the weakened valve and allows the stomach to empty. Small adjustments, such as shifting dinner from 8 p.m. to 6 or 6:30, can make a noticeable difference. The second approach involves using gravity to an advantage, elevating the head of the bed 4 to 6 inches, or using a sturdy wedge pillow discourages stomach contents from creeping upward. The incline doesn't need to be steep. Even a small change is often enough to reduce nighttime irritation and morning congestion. Third, limiting common reflux triggers in the evening prevents extra strain on the valve. Tomato dishes, fried foods, citrus, chocolate, alcohol, and late cups of coffee are leading culprits. These don't always need to be eliminated entirely. Enjoying them earlier in the day and choosing lighter foods like soup, oatmeal, or roasted vegetables at night can keep reflux under control without sacrifice. Portion size also plays a part. Large dinners stretch the stomach and raise the chance of backflow. Smaller, balanced meals eaten earlier lighten digestive workload and reduce nighttime irritation. Many seniors notice that simply scaling down portion size at night feels better not only in the throat, but also in overall rest, since digestion no longer interferes with quality sleep. It's important to remember, however, that reflux is only one potential explanation. For many, it is a common but easily missed piece of the puzzle, not the sole answer. Morning mucus has other possible drivers, including dryness, medications, or environmental triggers. That's why considering reflux as one possibility, rather than assuming it is always the cause, keeps the perspective balanced and accurate. A few safety reminders matter here. Anyone with ongoing heartburn, frequent chest discomfort, or new difficulty swallowing should tell a healthcare provider promptly. Silent reflux is manageable, but more serious conditions need to be ruled out, especially when swallowing feels restricted. Seniors should also never self-prescribe over-the-counter acid-blocking medications long-term without guidance, since the necessary dose or drug may differ based on medical history. For those who want to experiment safely at home, try these first-line changes tonight. Stop eating 2 to 3 hours before lying down. Elevate the head of the bed by 4 to 6 inches and avoid tomato-based meals, citrus, chocolate, and alcohol in the evening. These adjustments address the most common contributors to overnight reflux. If symptoms persist or grow uncomfortable, that is the time to bring details to a physician and ask about further reflux evaluation or treatment. The most encouraging message is that silent reflux is predictable and often preventable. It is not a random, mysterious process. The morning congestion linked with it can ease significantly once meals are timed differently, food choices are adjusted, and sleeping position is corrected. For seniors who once resigned themselves to waking each day with heavy mucus, these changes show that relief is realistic. When these strategies do work, they improve more than the throat. Waking with a clear voice and less discomfort strengthens confidence in daily routines. It restores ease to conversations, greetings, and even something as simple as reading the newspaper aloud without interruption. These are small but meaningful improvements that add up to better daily comfort. Even with reflux under control, many older adults notice mucus still feels unusually thick and difficult to clear. that lingering heaviness has another explanation related to how the body manages fluids with age. Sometimes, what seems like a minor adjustment in intake makes a big difference in how mucus behaves the next morning. The hidden role of dehydration. One of the less obvious, but highly influential contributors to daily mucus is dehydration. For seniors, the connection between fluid levels and mucus thickness is stronger than most people realize. Older bodies simply do not hold water the same way as they once did. With age, muscle mass decreases, and tissues store less fluid overall. At the same time, the internal signals that normally spark thirst become blunted. This means that by the time someone actually feels thirsty, the body is already running a deficit. The direct consequence is mucus that no longer stays thin and slippery. It turns sticky, dense, and far more difficult to clear. This shift explains why even small reductions in intake, skipping a few glasses throughout the day or relying mostly on caffeinated drinks, can make congestion far worse. Where younger adults may navigate mild dehydration without much impact, seniors don't have those reserves to buffer the loss. Even modest underhydration quickly thickens mucus, leaving it clinging to the throat or chest. For someone who already starts the day with slower sinus clearance, those small deficits amplify frustration and discomfort. Medication use complicates the situation further. Diuretics, which are common for blood pressure and heart failure, intentionally flush water from the body. Certain antidepressants, antihistamines, and anxiety medications reduce saliva or dry out the mouth. While these drugs are often essential, their side effects add to already limited hydration reserves. In response, the body tries to create a protective coating of mucus, but without enough internal moisture to keep these secretions thin, they instead build into heavy phlegm that irritates more than it soothes. This subtle, overlapping problem often goes unnoticed because the symptom doesn't present as thirst, it shows up as mucus. A person may spend days clearing their throat, sucking on lozenges or limiting speech, without ever realizing that dehydration is part of the cause. Because the body does not always warn through obvious thirst cues, it is easy for seniors to overlook this hidden role altogether. And when hydration is not addressed, even strategies like humidifiers or reflux precautions only provide partial relief. One woman in her late 60s demonstrates how small changes in fluid habits can alter symptoms. Despite careful diet and nightly use of a humidifier, she still woke every day with thick mucus that lingered. When encouraged to log fluid intake, she discovered she was averaging less than half of what her body needed. Over the following weeks, she began drinking additional cups of water and herbal tea at set times during the day. The difference was remarkable, not instant but steady. Each week her morning congestion eased. Her coughing spells shortened, and soon she could greet family confidently without apologizing for her hoarse voice. Practical steps like hers do not require major expense or complex therapy. The first key is consistency. Drinking large amounts all at once is less effective than spreading intake across the day. Regular sips give tissues stable hydration, allowing mucus to stay thin and movable. Pairing a glass of water with meals or taking a sip before each dose of medication creates natural reminders that make this habit easier to sustain. The second key is self-monitoring. An easy way for seniors to gauge hydration is by paying attention to urine color. Pale yellow usually indicates adequate intake, while darker shades often mean it's time for more fluids. This quick visual indicator works far better than waiting for thirst, which can be unreliable in older adults. Building awareness, this way helps people notice small improvements before discomfort escalates into thicker secretions. The third key is remembering hydration isn't just about plain water. Herbal teas, broth-based soups, smoothies, and water-rich fruits like melon or oranges all contribute meaningfully. Choosing these foods helps keep intake varied and easier to sustain. By contrast, relying heavily on coffee, black tea, or alcohol can actually counterbalance progress. These drinks encourage the body to lose more fluid, which is why seniors who drink multiple cups of coffee, yet little water, often continue to struggle with sticky phlegm. Even replacing just one caffeinated drink with an herbal tea or a glass of water can nudge hydration in the right direction. Of course, a safety caveat matters here. For seniors taking diuretics or living with chronic heart or kidney disease, fluid targets should not be based on general rules alone. In these cases, intake must be discussed with a clinician to ensure safety. Extra fluids may be beneficial for mucus, but harmful for other conditions if not carefully balanced. That is why any sustained change should be confirmed with a prescriber or care team. The overall principle remains: hydration matters, but the exact goal should always be individualized. What makes this strategy especially powerful is its practicality. Where some remedies require machines, prescriptions, or specialist appointments, hydration can be improved immediately at home. No additional cost, no complicated setup, just steady awareness and small daily adjustments. It's the sort of foundational support that magnifies the effectiveness of all other approaches, whether that's adjusting bedtime meals, addressing medication side effects, or controlling indoor air quality. Results often appear gradually. Just as dehydration takes days to build, rehydration produces subtler day-by-day improvements. Within a week, many seniors feel less raw irritation in the throat or find that morning mucus clears with fewer attempts. Within a month, conversations flow more comfortably, with less background coughing or throat clearing. Instead of a persistent nuisance that seems beyond control, congestion becomes something the body can manage. The science is clear. Older adults face unique vulnerabilities to dehydration because of reduced reserves, dulled thirst cues, and common medications. Each of these factors pulls the body in the direction of thicker secretions. The practical response is surprisingly simple: active, deliberate hydration throughout the day. Whenever it feels like mucus worsens for no reason, fluid balance is one of the first things worth checking. This is why hydration should be regarded not as an optional extra, but as a central piece of the routine. It is often overlooked because it feels too basic to matter, yet the evidence and lived experiences show it can reshape daily comfort. Paired with physician guidance when needed, steady fluid intake becomes a low-cost, reliable way to ease a problem that otherwise feels stubborn. Still, hydration by itself does not explain every flare-up. Many seniors with adequate fluid intake notice their symptoms still vary sharply from day to day. That raises another question. Why do meals themselves sometimes trigger sudden heaviness in the throat or tougher coughing spells soon after eating? Foods that secretly stoke mucus production. Meals themselves can sometimes become quiet contributors to heavier, stickier mucus. Certain foods do not trigger symptoms for everyone, but many older adults notice specific patterns. What they eat in the evening can influence how congested they feel the next morning. While age, medications, and environmental factors all play major roles, the items on a plate may still shape comfort more than expected. Mucous membranes respond not only to infections or irritants, but also to dietary habits that either soothe or inflame them. Being aware of these patterns matters because seniors can spend years avoiding the wrong foods, while overlooking those that truly make their mornings worse. For a long time, dairy carried the blame as the main dietary culprit. Many families believed that milk, cheese, or ice cream created more mucus outright. Research, however, paints a more nuanced picture. Dairy doesn't consistently increase mucus in all people, but it may make it feel thicker for some. The creamy texture can leave a coating in the mouth and throat, which exaggerates congestion, especially for those already dealing with post-nasal drip or reflux. For others, it has little or no impact. The evidence is mixed, so instead of assuming dairy must always be eliminated, a short personal test is more reliable. If symptoms worsen after dairy, reduce or shift it earlier in the day. If they do not, strict avoidance may not be necessary. Focusing only on dairy, however, causes many seniors to miss bigger influences. One strong category is processed foods. Packaged snacks, frozen dinners, deli meats, and fried fast food contain additives, preservatives, and refined oils that irritate the lining of airways. The body counters this irritation by increasing secretions, but without proper hydration, those secretions thicken. On top of that, processed meals often carry high salt loads. Excess salt dehydrates tissue, leading to tougher mucus clearance. Seniors who lean heavily on these quick, convenient foods may see congestion build not because of aging alone, but because of the inflammatory cycle these items trigger. Swapping a late processed snack for something lighter, like fresh fruit, warm oatmeal, or soup, can break that cycle. Sugar is another driver often overlooked. High sugar intake fuels inflammation throughout the body. That inflammatory state thickens secretions and makes the airway lining more reactive. Seniors who enjoy nightly desserts or multiple sweet drinks may not connect the dots between their treat habit and the heaviness in their throats the next morning. Unlike dairy, sugar doesn't just influence texture. It can change how the immune system behaves. The pattern often emerges gradually. Day by day, the mucus feels the same, but over weeks and months of steady sugar intake, the morning load worsens. Reducing added sugar, even modestly, often creates a clearer difference in mucus consistency. Caffeine deserves attention, particularly when consumed later in the day. Coffee and black tea are central to many daily routines, yet they influence mucus in two ways. They act as mild diuretics, pushing more water out of the body. Less hydration means mucus thickens. They also relax the lower esophageal sphincter, the valve that protects against reflux. A weakened valve allows small amounts of stomach contents to creep upward when lying down, irritating the throat and prompting more protective mucus. Seniors who enjoy coffee or strong tea in the evening may unknowingly be setting themselves up for heavier mornings. One practical adjustment supported by research is cutting off caffeine after mid-afternoon and switching to non-caffeinated teas at night. Late and heavy dinners interact with these choices in powerful ways. Large meals stretch the stomach, generating upward pressure against the esophageal valve, especially when lying down soon after. This promotes reflux events, even without obvious heartburn. Meals rich in fried foods or tomato sauces intensify the effect. The outcome is thick mucus hours later, lingering well into the morning. Portion adjustments, smaller plates earlier in the evening, can reduce strain while still allowing for satisfying meals. Seniors often give up foods based on myths while leaving the true irritants untouched. A person may avoid every dairy dish at family gatherings while continuing to drink coffee late, eat fried food for dinner, and snack on processed pastries, the very combination that drives their mucus issues. The mismatch creates frustration because the sacrifices feel strict, but relief remains out of reach. Making progress requires shifting from broad restrictions to targeted testing. One practical approach is a food log and elimination trial. Instead of removing entire categories indefinitely, try setting aside 2 weeks to limit 1 or 2 common triggers: late heavy dinners, caffeine after lunchtime, or fried processed meats. Each morning, write down how the throat feels, whether symptoms improve, worsen, or stay unchanged. This written record makes links easier to see. If congestion eases during the trial, the connection is strong. If nothing changes, that food can often be reintroduced with moderation. This approach reduces guesswork and prevents unnecessary long-term sacrifice. A man in his late 60s illustrates this method well. Convinced dairy was ruining his mornings, he cut ice cream, yogurt, and cheese completely. His symptoms barely changed. Frustrated, he assumed nothing could help. At a dietitian's suggestion, he kept a 2-week food log. The results pointed elsewhere. Fried meats, packaged snacks, and evening coffee were the most consistent links. Once he cut these back and ate lighter evening meals, his symptoms eased. Eventually, he reintroduced moderate dairy without any major issue. Targeted adjustment, not blanket removal, proved effective. Most people find moderation works better than strict rules. For dairy, smaller portions earlier in the day, with lunch instead of with dinner, reduce the chance of a morning impact. Sugar is more manageable when reserved for occasional events rather than nightly habits. Coffee can stay a morning comfort, while herbal teas replace it in the evening. The point is not to deny all favorites, but to time and balance them in ways that support clearer mornings. Seniors gain relief without losing the social and personal enjoyment that meals bring. The broader lesson is that food responses vary. The same bowl of soup or cup of coffee may affect one person strongly and another barely at all. Personal trial is the only reliable test. What matters is how a specific body, at its specific stage of health, responds. Recognizing this takes the pressure off copying rigid avoid lists and instead builds insight step by step into one's own patterns. Practical swaps help reduce daily irritation. Replacing fried evening meats with baked fish or roasted vegetables, trading pastries for fresh fruit, shifting late coffee to caffeine-free tea, or choosing water over soda. Each of these changes cuts back on inflammation, dryness, or reflux triggers. When paired with hydration and environmental supports, they ease daily mucus without demanding a joyless or extreme diet. The result is a more balanced way to live. Instead of fearing meals, seniors reclaim confidence in eating, socializing, and resting without an automatic cycle of coughing and congestion. The progress can be steady rather than perfect, but even partial relief makes mornings smoother. At the same time, it's important to recognize limits. Not every case of mucus comes down to diet, humidity, or hydration. Sometimes persistent or worsening symptoms point to a deeper issue. And when changes in meals or daily habits don't provide enough relief, it signals the need to ask whether the body is pointing to something more serious. That question becomes crucial when deciding how long to wait before involving a doctor. When mucus signals something bigger, sometimes mucus isn't just a nuisance. It's a signal that something more is unfolding beneath the surface. When symptoms drag on, worsen, or come with changes in breathing or energy, the issue may point to underlying conditions rather than everyday irritation. Recognizing when congestion crosses this line is important because older adults are more prone to complications if early warnings are missed. Treating mucus as a potential clue, not merely a side effect of age, can make the difference between comfort and a delayed diagnosis. Normally, the body produces just enough mucus to trap irritants and protect airway tissues. With aging, it often thickens, but that alone doesn't always indicate a problem. What should raise concern is when the sensation continues month after month, or when it changes character in ways that don't match occasional dryness or reflux. Persistent, unexplained symptoms may connect to conditions that become more common with age, and that require more than home remedies. Chronic obstructive pulmonary disease, COPD, is one striking example. It includes emphysema and chronic bronchitis, both of which are strongly linked to long-term irritation of the lungs. One of the earliest signs of COPD isn't severe breathlessness. It's a cough that consistently produces mucus without another clear explanation. Chronic bronchitis, in particular, involves ongoing inflammation where the airway lining produces excess secretions as a defense. That daily cycle of congestion, if ignored as just aging, can mask COPD until it advances. And once COPD progresses, it often limits activity, increases risk of infection, and dramatically impacts quality of life. Another overlooked association is sleep apnea. Many think of it only as pauses in breathing or loud snoring, but repeated airway obstruction during sleep creates irritation, swelling, and post-sleep congestion. The body responds by producing thicker mucus, often coupled with a morning cough. The mucus isn't random. It's part of the airway's reaction to repeated stress. Left untreated, apnea raises risks for heart disease, oxygen drops at night, and severe fatigue during the day, making congestion one of the earliest outward signs of a condition that needs medical attention. The heart itself can be involved. When it struggles to pump efficiently, fluid may linger in the lungs. This does not resemble the irritation caused by dry air or dairy. It's fluid buildup linked to cardiovascular strain. Seniors might notice greater shortness of breath, coughing spells when lying flat, or mucus brought up that feels heavier than normal secretions. Ignoring these symptoms risks allowing potential heart failure to progress unnoticed. Early evaluation with a doctor can clarify whether the problem starts in the airways or deeper in the circulatory system. Numbers highlight why these signals matter. Current reports show that more than 1 in 5 adults over age 65 live with some form of chronic respiratory disease, many without realizing it. Furthermore, older adults account for the majority of severe outcomes from respiratory infections, underscoring why persistent mucus, especially in this age group, deserves a closer look. In many cases that end with advanced disease, the earliest indicators started quietly, symptoms brushed off as nothing more than phlegm. Of course, not every case of daily mucus signals a chronic illness, but there are clear red flags that should not wait. These include a cough with mucus that lasts longer than 2 or 3 weeks, sputum that appears bloody or rust-colored, unexplained or worsening shortness of breath, repeated fevers, or unintended weight loss, and any increase in congestion that limits your ability to walk, climb stairs, or carry out daily activities. When symptoms fit these patterns, they should be treated not as irritations, but as warnings, and they warrant a direct conversation with a healthcare professional. If you notice one or more of these signs, the best first step is simple. Call your primary care provider and ask for a focused respiratory evaluation. Based on your symptoms, they may order basic but revealing tests such as a chest X-ray or spirometry, which checks lung function. These tools help distinguish between conditions like chronic bronchitis, reflux irritation, or cardiovascular stress. With clear results, your provider can decide if medication, lifestyle changes, or specialist referrals are appropriate. Addressing symptoms sooner has advantages beyond medical safety. It can also protect day-to-day comfort and connection. Seniors often withdraw from social activities out of fear that constant throat clearing or coughing will disrupt conversation. Over time, this pattern can lead to isolation. A single evaluation that reveals a manageable explanation helps break that cycle, restoring confidence to talk, sing, or simply enjoy meals with others without feeling self-conscious. It's worth repeating that everyday supports, hydration, dietary shifts, humidifiers bring genuine relief for many. But when problems persist despite those measures, they should not be dismissed. Home strategies improve comfort, yet they cannot replace medical treatment for COPD, heart strain, or other clinical conditions. The most effective approach is combining both. Use natural strategies to improve quality of life and seek medical expertise to rule out or address deeper causes when signs point in that direction. Practical awareness empowers this balance. Seniors who watch for shifts in mucus over time, note when symptoms worsen, or record when breathing feels more difficult give their providers valuable information that accelerates accurate care. What may feel like a small inconvenience on your end can provide the clinical clue a doctor needs. Sharing these details without holding back often leads to clearer answers and more targeted treatment than struggling in silence. Ultimately, mucus should be seen as a messenger. Sometimes it reports nothing more than low humidity or a heavy meal late at night. Other times, It carries the first hint that conditions like COPD, sleep apnea, or heart failure are beginning to show themselves. Being cautious, taking note of red flags, and seeking evaluation early prevent those small signs from hardening into advanced, overwhelming illness. For seniors, the benefit of proactive attention is straightforward. Instead of living with worry, they gain clarity and a plan. Whether the outcome is reassurance or a structured treatment path, both are victories. Either way, listening to this daily signal turns uncertainty into direction. That awareness also raises another question many grapple with: why do the simple remedies that used to work decades ago, teas, sprays, lozenges, suddenly lose their impact? Why old remedies fail after 60? By the time someone reaches their 60s or 70s, it's common to notice that remedies once trusted, sprays, lozenges, herbal teas, or over-the-counter syrups, just don't work as they used to. Instead of lasting for hours, the relief is often fleeting. Mucus that would once thin out stubbornly lingers, and what felt reliable in middle age seems to offer barely a fraction of the benefit. This shift is not because those remedies have suddenly lost power, but because the body itself has changed in how it responds to them. Much of this comes down to physiology. With age, metabolism slows. The liver and kidneys, which process medications and herbal compounds, work at a different pace. Enzymes that once cleared ingredients smoothly now take longer, altering both the strength and duration of their effects. A cough syrup or decongestant that had a strong and predictable effect in one's 50s may now take longer to act, wear off faster, or cause stronger side effects that overshadow any benefit. On top of this, older tissues themselves are less resilient. The nasal lining loses elasticity and moisture, so saline sprays or lozenges that once hydrated effectively no longer retain the same impact. The combination of slower processing and drier tissues explains why remedies now fade quickly, leaving many seniors puzzled and discouraged. Another factor is polypharmacy, the reality that most older adults take multiple prescriptions at once. Each drug competes for the same processing systems, so interactions are far more likely. Over-the-counter remedies and supplements join that mix, making overlap even more common. A throat-coating tea that worked well years ago may now feel useless because prescribed medications alter stomach acid, saliva balance, or tissue dryness. Instead of failure on the remedy's part, it's the crowding effect of multiple drugs that weakens the response. Clinicians frequently adjust within the same drug class, such as switching one blood pressure medication for another when dryness or cough appears, often restoring balance without sacrificing safety. This is why medication review is one of the most important steps for seniors who face stubborn mucus. Geriatric guidelines consistently recommend that patients bring a complete list of everything they take: prescriptions, over-the-counter products, supplements, and even teas, to every appointment. Without that information, it's nearly impossible for a clinician to spot the interactions that dull relief. Just as important, no one should ever stop or alter dosages on their own. Safety depends on discussion. Adjustments, alternatives, or timing changes must always be guided by a prescriber who can weigh risks against benefits. That brief, honest conversation is often the turning point between remedies that feel useless and strategies matched to current physiology. Old remedies, then, are not truly failures. They become mismatched once the body changes pace, chemistry, and sensitivity. Real improvement comes from updating the approach, hydrating tissues more deliberately, using modern saline formulations, or combining simple remedies with environmental changes like humidity control. When viewed this way, the decline in effectiveness is less discouraging and more of a cue to realign treatment with current needs. This adaptive mindset restores control at a stage of life where frustration otherwise grows unchecked. Even so, sticking only to medical and mechanical fixes sometimes overlooks another powerful dimension: Symptoms like mucus don't just weigh on the throat or chest, they add a constant emotional burden that older adults often carry in silence. And sometimes the best way to lighten that load starts from an entirely different place: how the mind and spirit respond. Humor helps clear more than the throat. Humor might not be the first tool people think of when dealing with mucus, but it plays a surprising role in how manageable the symptoms feel day to day. While mucus affects the body, the frustration and embarrassment that come with it often weigh just as heavily. Humor lightens that burden. It lowers tension, eases social discomfort, and shifts focus away from the constant annoyance of coughing or throat clearing. For many seniors, laughter becomes less about curing the problem and more about making it feel less controlling. The simple act of laughing sparks changes in breathing. It naturally draws in deeper breaths and can feel like a short bout of light exercise for the chest muscles. In this way, laughter creates a rhythmic flow that encourages fuller inhalation and exhalation. That extra movement may feel refreshing, almost like opening a window after stale air has built up. Still, it's important to be clear: laughter is not a treatment for mucus. At best, it works as an adjunct, adding a moment of relief alongside practical supports like hydration, humidity, diet adjustments, and medical care. Where humor shows its real strength is in its impact on mood and social comfort. Seniors dealing with ongoing congestion often feel embarrassed when symptoms interrupt conversations. Coughing or clearing the throat can spark self-consciousness and even lead to avoiding group gatherings altogether. Over time, this retreat from social life increases stress, and stress itself has been linked to stronger inflammatory responses. By reducing stress through laughter, people often find their overall symptoms feel less heavy, even if the underlying mucus hasn't disappeared. Research on quality of life in older adults echoes this. Emotional strain, particularly embarrassment and frustration tied to chronic congestion, can worsen the experience of living with mucus far beyond the physical discomfort alone. Humor interrupts that pattern. A shared laugh reframes the situation. Instead of being the individual who disrupts the moment with a cough, the person becomes part of a connection. That connection reduces isolation, which in turn lowers stress, softens tension, and makes coping easier. One practical example comes from community groups that normalize symptoms with humor. Instead of awkward silences after someone coughs, members briefly laugh together and continue the conversation. What might have felt like shame instead becomes a moment of shared humanity. Though this doesn't change mucus production, it changes how people feel about it, and that directly impacts quality of life. Seniors often describe these lighter moments as more effective than any lozenge because they restore confidence to be present with others. Importantly, humor can be self-directed too. Watching a short comedy before bed, listening to lighthearted radio shows, or sharing funny stories with family builds in moments where laughter interrupts the cycle of frustration. Consistency matters more than duration. Even small bursts of humor, practiced daily, become part of a healthier rhythm. They lower stress, shift attention, and lessen the emotional hold that mucus has over daily life. Skeptics may wonder how laughter, which seems so intangible, could have such an effect on a physical symptom. The explanation lies in the interplay between the body and mind. Stress hormones, when elevated day after day, sensitize tissues and heighten irritation. By easing stress through humor, even briefly, people give their body a chance to settle into a calmer state. In this sense, the laughter itself doesn't clear mucus, but helps create conditions where other remedies work more smoothly and symptoms feel less overwhelming. Social circles play an important role here as well. Humor fosters an environment where seniors feel less judged when symptoms appear. A grandson laughing kindly as a grandparent clears their throat, or a group of friends turning persistent coughs into a shared joke transforms a moment of vulnerability into one of belonging. Emotional health and physical health reinforce one another. Reducing shame encourages seniors to stay engaged with family, attend community activities, and remain active habits that benefit their overall well-being. This makes humor not just an optional extra, but a supportive layer in the larger strategy of managing mucus. Consider the difference between waking up dreading every interaction because of congestion versus approaching the day with the mindset that humor will serve as a buffer. That choice changes outlook, reduces stress, and makes it more likely that environmental and dietary strategies are followed consistently. In other words, humor improves adherence to healthier habits by making life less discouraging. For seniors worried about adding humor when congestion already feels overwhelming, one simple tip is to try building a short, planned, humorous pause among friends or family. If coughing interrupts a conversation, leaning on a shared joke rather than apologizing shifts the mood from embarrassment to acceptance. The laughter anchors the moment around connection instead of discomfort. Research on geriatric rhinitis highlights exactly this point. Quality of life impacts are as important to address as symptoms, and social support offers one of the strongest buffers. It's worth emphasizing again, humor does not replace medical guidance or basic supports. It does not thin mucus, repair airway tissue, or stop reflux. What it offers is a way to reduce the emotional load so that symptoms don't define the entire day. By lowering stress and boosting social comfort, humor improves resilience. Resilience, in turn, helps seniors stick with hydration routines, remember to adjust evening meals, or keep consistent with humidifier use. Progress doesn't come from humor alone, but humor makes progress easier. Approaching mucus problems with humor reframes the experience. Instead of viewing symptoms as an obstacle that isolates or embarrasses, they become part of a human condition that everyone can relate to at some point. That perspective shift matters. It allows seniors to continue engaging in social life with confidence rather than withdrawal. And in every laugh, there is a reminder that life is still bigger than the irritation of mucus. When viewed this way, laughter becomes a support system layered over everything else, from doctor-prescribed treatments to simple home remedies. It's accessible, safe, and cost-free. Seniors who add it intentionally into their routines often find that their days feel lighter, even if their mornings still begin with clearing their throat. Relief becomes less about eliminating mucus entirely and more about living fully alongside it. In the end, humor's role is straightforward but powerful. It doesn't erase the presence of mucus, but it restores perspective, eases tension, and renews resilience. Each smile or shared laugh is a reminder that symptoms may be frustrating, but they don't define the entire picture of aging. That reminder itself clears more than just the throat. It clears stress, isolation, and discouragement. And with that perspective established, the real work begins. Recognizing what daily mucus is truly telling you and how to respond to it in ways that improve both comfort and well-being moving forward. Daily mucus doesn't happen by chance. It's your body signaling that something needs attention. The encouraging part is that relief often comes from simple adjustments. 3 starting points stand out. First, check your environment and keep bedroom humidity in the 40 to 50% range. Second, review your medications with your doctor, including any over-the-counter products and supplements. Third, test practical habits like steady hydration, avoiding late heavy meals, and trying a short food or reflux trial. If you tried any of these and noticed improvement, drop 1 sentence in the comments. It may help someone else. And if this was useful, subscribe for more practical aging tips. You do not have to accept morning mucus as inevitable. Start with 1 small change tonight.